Again. Good morning, sir. My name is Tricia, your physical therapist for today. So for verification purposes, may I know your name and age?
Miss Jan Abantao 22.
Okay. So for safety purposes, we need to wear the mask the whole duration of the assessment and intervention, and then we're gonna sanitize. Okay. So today, sir, you're here because of a Dr. longus rupture. So there's a problem of you experience a gnawing pain, and then decrease of motion in your legs, and then you have a decrease of strength. So this is currently in the chronic stage. So we're gonna do our goal is to relieve you of the pain, and then increase the range of motion, or regain the full range of motion and increase of strength. Okay, sir? Okay, so for this we're gonna do the plan of care prepared. Before we proceed with the plan of care, I need to check your vital signs: the blood pressure, temperature, pulse rate, and respiratory rate. So for the blood pressure, we're gonna be using the sphygmomanometer and stethoscope. Sir, may I? Your blood pressure is normal. Then we're gonna check your temperature. We're gonna be using the thermometer. So respiratory rate, pulse rate, temperature, and blood pressure are within normal, so that we can proceed with the interventions. Okay. So we're gonna start with for the first stage. We're gonna ask you for the first phase. I would like you to immobilize your legs. So if you need to keep your legs well rested, and then keep it elevated if you're resting. And then we're gonna do an ice pack, 15 to 20 minutes to 3 times a day. Okay, we're gonna be applying it in the area of the affected area. Next, we're gonna do some stretching or strengthening exercise. So we're gonna start with side leg raises. So I would like you to lie down, sir, in your side. Okay, and I would like you to raise your legs side apart. Okay, then down, then raise. We're gonna do this 10 times, 3 sets in both legs. Next is we're gonna do some squats. Okay, so I would like you to stand up, sir. Up. We're gonna do a wide leg squat, and then squat with that squat. Okay. We're gonna do the same 3 sets and 10 times. Next is we're gonna do a side leg raises. Side leg raises, and then leg raises. The same 3 times and 10 sets. 3 sets and 10 times. Now we're gonna proceed to the next is when you are capable of doing the exercise all throughout. We're gonna start with the mobility exercise. We're gonna start with the walking exercises. So walking exercises, I'm gonna ask you to walk in a certain distance, and then depending on the speed you can handle. So if improvement is seen, we're gonna increase the distance as well as the speed. Okay, sir? Then now, if you can perform that already, we're gonna do the biking exercises. So we're gonna start it with a warm up like we did earlier, the stretching of the legs. And then after that, we're gonna do some biking exercises with the same procedure with the walking, wherein we're gonna progress depending on what we can handle. Okay? And now we're gonna start to a little massage to relieve the soreness. Okay, sir? Okay. So for a few precautions and reminders that if you feel unusual pain, inform me immediately. And then if there's any uncomfortable, if you're uncomfortable of the exercise, tell me also, okay? And if it's not bearable, tell me. Okay, sir? Okay. So I would like you to make sure that you make sure that there's always assistance once you perform those exercises. Okay? So that's it for today, sir. Thank you and have a nice day. Okay, so we're gonna do an aftercare, clean the area.